This medication, Wera, is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Wera may make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and also treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. It is recommended to take Wera at the same time every day to ensure its effectiveness. Before starting to take Wera, it's important to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take the pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Typically, Wera is taken once daily by mouth. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Be sure to carefully follow the manufacturer's directions for your specific brand. It is crucial to continue taking Wera exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important that you follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, this can affect the effectiveness of the birth control pills. In this case, you may need to use a backup birth control method, such as condoms or spermicide. Be sure to follow the directions in the patient information leaflet and check with your doctor or pharmacist for more details. Taking Wera after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may also choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is crucial that you take Wera at the same time each day, 24 hours apart. Be sure to ask your doctor or pharmacist if you have any questions. Your pill pack contains 21 pills with active medication, and it may also contain 7 reminder pills with no medication. Take one active pill, with hormones, once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using Wera and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking the medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you have any questions about switching from other forms of hormonal birth control to Wera, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Wera may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to note that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. While many people using this medication do not experience serious side effects, it's important to monitor your blood pressure regularly and report any high results to your doctor. Contact your doctor right away if you experience any serious side effects, including lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, this medication may cause serious problems from blood clots. Seek medical help immediately if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, weakness on one side of the body, or vision problems/changes. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. These are not the only possible side effects of Wera, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are a smoker and over 35 years old, it is important to note that using Wera can increase your risk of stroke, heart attack, blood clots, and high blood pressure. This risk becomes higher as you get older and smoke more cigarettes. Therefore, it is advised not to smoke or use tobacco while taking Wera. Before taking Wera, make sure to inform your doctor or pharmacist if you are allergic to any estrogens or progestins, or if you have any other allergies. Also, discuss your medical history, especially if you have a history of blood clots, high blood pressure, depression, diabetes, heart problems, liver or kidney disease, or thyroid problems. If you have diabetes, monitor your blood sugar regularly and inform your doctor if you notice any changes. If you have phenylketonuria or diabetes, be cautious as chewable tablets may contain sugar and/or aspartame. Let your doctor know if you are planning to have surgery or will be confined to a bed for a long time, as this medication may increase your risk of blood clots. Using Wera may cause blotchy, dark areas on your face and skin, so limit your time in the sun and use sunscreen. If you are nearsighted or wear contact lenses, you may develop vision problems, so contact your eye doctor if needed. It may take longer to become pregnant after stopping Wera, so consult your doctor if you are planning to conceive. This medication should not be used during pregnancy, and if you become pregnant while taking it, inform your doctor immediately. It may also decrease breast milk production, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Wera, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Wera include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively. If you start any new drug, discuss with your doctor if you should use additional reliable birth control. Also, if you experience any new spotting or breakthrough bleeding, it may be a sign that your birth control is not working well. Furthermore, Wera may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. If you suspect someone has taken too much Wera and they are experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. For Canadian residents, you can contact a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Always seek medical help if you believe someone has taken too much Wera. It's important not to share Wera with others. Make sure to attend regular physical exams and medical tests while taking this medication, including blood pressure checks, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Keep all medical and lab appointments, and consult your doctor for more details. If you miss a dose of Wera, refer to the product package information for advice on what to do. To prevent pregnancy, you may need to use backup birth control methods like condoms or spermicide. If you have any questions, make sure to ask your doctor or pharmacist. If you find that you often forget to take your Wera pills as directed, it's a good idea to talk to your doctor about possibly switching to a different form of birth control. Make sure to store Wera at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. Do not flush Wera down the toilet or pour it into a drain unless instructed to do so. When Wera is expired or no longer needed, be sure to discard it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.